Hello and welcome. Hello, sir. Welcome to the show.
Thank you.
We have with us Dr. Jonathan. How are you doing, sir?
I'm having a great time in India.
Yes, sir. It's been a long journey in the field of dentistry, I would say.
I would suppose so.
Can you brief us little with your background, that how this dentistry happened to you?
I didn't intend on getting into dentistry in the first place. I was always interested in science,
Okay.
but I felt that it was a bit boring
Okay.
working in the research lab all the time. I wanted some human interaction. I
Okay.
felt that dentistry gave me the best of both worlds, both interacting with people as well as dealing with the scientific aspect of my curiosity.
Right. So, what was that journey of your post-graduation days?
I would say that postgrad days were actually quite fun.
Okay.
It's a little known secret that in Singapore,
Uh-huh.
perio is actually the easiest program to go through.
Oh, nice.
Yeah, I wanted to do oral surgery at first, but I look
Okay.
at the life of oral surgeon, that's not for me. And I thought maybe I can go into perio and do a bit of surgery, and I'm not looking back.
Oh,
It's been an amazing journey.
nice. You must be presenting many papers and posters during your graduation days, as well as you have mentioned that you have also presented papers as well as posters in many international conferences as well.
I did present some posters at EAO in Madrid, the AAP in Chicago, as well as Europerio. I think the one I did was in Amsterdam. Yeah.
So the first key point for poster and paper presentation is, I would say, record maintenance.
You're absolutely right.
Yeah. So, sir, could you please guide us then how can students like me or postgraduates can maintain a good records of the patients they are doing?
I think when you're postgrad, you try to find an instructor who helps you take good photos.
Okay.
That's of key importance.
Uh-huh.
But more than just taking photos with the intention to present papers, it's more for our own records, so that we can see if the surgery turned out well, we can see what went well. If something didn't turn out well, we can see what goes wrong. So even up to today, although I'm no longer a student, I don't really present any more posters. I still take photos from time to time to give a record of what I'm doing, to see how I can do better, what can I avoid, or if I've done well, how can I do that for the next patient.
And what sort of equipments or I would say instruments students should invest in for record maintenance?
You don't really need something expensive, just a normal camera, having the ring flash, and some basic mirrors. That's all you need.
That's all.
Yeah.
Okay.
Of course, if you want to take something more fancy with all the soft boxes and stuff, you can go on to do that, but I don't really do that.
Right. And what sort of computer programs?
I think that works absolutely fine as long as you know how to do a good layout and stuff like that. For me, because I use a Mac, so I use Keynote most of the time. But sometimes I do prepare presentations on PowerPoint as well. So you don't really need something special. You just need that time to go through it, to crop the photos nicely, and to have a good sequence of what you're doing.
Do you think that design matters or color combination matters apart from your knowledge?
I think a bit matters because you want to capture the attention of the audience, but you just do that to a small degree and don't really need to chase that, because what matters most is the quality of your work. So if you spend time honing your skills, achieving the best for your patients, I think that speaks volume of what you're doing.
On what actual aspect we need to focus on?
I think what we need to focus on is the content delivery, because sometimes in our mind, we think of things in a very complicated way.
Exactly.
But we have to think about the audience. If they have no background knowledge of the topic you're presenting on, they don't know the thought process that goes through our mind, how can we make it simple for them? And also bear in mind that each audience probably has a very short attention span after listening to whole days of lecture. So we have to keep it concise, tell them what we want to tell them to the point, and then present it in a manner that's easy for anybody to understand.
Right. As you told, our audience has very short attention span, so we will have to end this conversation here. But on the contrary, as sir mentioned earlier, the sir is talkative, so we're looking forward to a full-length episode shooting with you very soon.
Sure, thank you.
I hope you will come to our platform again and again and share some of the good tips for our postgraduates as well as graduates.
There's always the chance I would be happy to do so.
Yeah, sure. Thank you so much
so
for your time.
Thank you.
So kind of you.
I wish you all the best.
Thank you.